Welcome to part 3 of our videos on the peripheral nervous system. Where we left off, you're going over the cranial nerves. So I want to go over some of them again. So they're numbered 1 through 12, starting with rostral as number 1. And number 12 is most caudal. Now this one is the most rostral, and it's called the olfactory. It has the olfactory bulb and the olfactory nerve or tract. And the olfactory nerve gives you your sense of smell. Now here is the optic nerve. Now the optic nerve goes to your eye, and it gives you your sense of vision. Now this little thing right here, coming off the mesencephalon right next to the mammillary bodies, remember, do not give those nipples, that, even though it's a little nerve, actually comes all the way to the eye, and it's going to go to the pupils and control the size of the pupils, and it's going to go to the extrinsic muscles of the eye that let you roll your eyes at people. Then, coming from the back of the pons is this thing right here. And it too is going to go all the way up to the eye, and it's going to go to this muscle called the superior rectus, and it's going to control movement of that muscle. And because it's a pulley system, the nerve is called the trochlear nerve. So the olfactory and the optic are sense only, ocular motor and trochlear are motor only. Then we come to my favorite nerve right here, called the trigeminal. So the trigeminal nerve here is our first mixed nerve. It has branches going to the muscles that give you mastication, and it goes to the skin all over the face. So the trigeminal nerve here goes to the muscles of mastication, and it goes to sensory receptors all over the face. And it is big. So over here, it looks like there's 3 there. First of all, that's further caudal, and they're not as big as this big, meaty trigeminal. It has 3 very large branches. Then we have the abducens. The abducens is coming off of the mesencephalon, and it's going to go to the lateral rectus muscle. So it's going to the lateral rectus muscle, and it's going to abduct. So the trochlear here is actually on top. This is more to the side. I didn't really do good perspective right here. And that brings us to where we left off, the facial nerve that actually has 2 branches right where it comes off. So the facial nerve does a little bit of everything. Efferent somatic to facial muscles. It lets you wink your eyes and smile and frown. It has autonomic nervous system functions. It lets you salivate. It has branches going to the lower salivary glands, to the tear ducts, and the mucous glands of the nose. And afferent taste, so afferent somatic to the anterior third of the tongue, or 2/3 of the tongue, and that goes to the insular lobe. Now, I'm not going to test you on this page, but I think it's really cool. There's a little tiny hole between the styloid process and the mastoid process called the stylomastoid foramen. It's itty bitty. That's actually where it comes out. And it's going to have 5 branches. If you put your hand on the side of someone's face like this, you can see where those branches are. The temporal branch goes on the temporal bone. The zygomatic branch over the zygomatic bone. Buccal over the buccinator. Mandibular branch over the mandible. And then down to the neck is the cervical. So this is a way, if you ever have to remember how, you can remember them. Cranial nerve number 8 is the vestibulocochlear nerve. It gets its name because it comes from the vestibule, which is right there. It actually has branches going to the semicircular canals as well. And the snail-like thing's actually called a cochlea. So the cochlear nerve and the vestibular nerve merge together to form the vestibulocochlear nerve. And it's right here, right next to the facial nerve. And again, remember I said how it's confusing because we have the big trigeminal here that actually has 3 branches. This looks like 3 things as well, but they're a lot smaller. This little bit of the facial nerve is super, super small, where the middle branch of the trigeminal is humongous. So it is sound, hearing, auditory, going to the temporal lobe, and balance going to both the insula and the cerebellum. So the vestibulocochlear is only somatic sense. So our mnemonic, to touch and feel very. So our next one is the glossary is mouth, pharyngeal, your pharynx is the tube at the back of your neck. And again, here's our brainstem. Here is our trigeminal with its 3 big branches. We have our little tiny pathetic abducens. We have our facial, that looks like it's 2 things, but it's really 1. And then we have our vestibulocochlear nerve going to the ear. So right here, so these are all coming out underneath the pons. Right here, a little bit lower, is the glossopharyngeal nerve. And this is the check all box nerves. It is afferent somatic to the back third of the tongue. So we're going to the back third of the tongue for taste. It actually has nerve endings going to this thing called the carotid body or carotid sinus. And it's looking at blood gas levels, blood pH, blood pressure. So that's visceral afferent. So it's things we're not aware of. It has efferent autonomic salivation. So it goes to our bigger salivary gland. And this always bugs me because I want the facial to go to the bigger one because it's closer to the top. Doesn't work that way. And then efferent somatic, it goes to the muscles of swallowing and some of the muscles of gagging. So we've checked all the boxes. It has somatic motor for swallowing, somatic sense for taste of the posterior third, autonomic motor, salivation, visceral afferent blood gas and blood pressure. So we have olfactory, optic, ocular motor, OOO, trochlear, 2, trigeminal, touch, and abducens, facial, feel, very, vestibulocochlear, good. This is going to be velvet. So the vagus nerve comes off the brainstem right here, caudal to the glossopharyngeal, which is caudal to the vestibular cochlear. This little special one's the hypoglossal. Now, what it's going to do is it goes out the jugular foramen. So the vagus is a very busy nerve. It's coming off right here. So there's the jugular foramen. Now, it's going to have tracts, and this one's going to go to the pharynx. And in the pharynx, it is going to be afferent sensory, taste from the pharynx. This is mostly bitter and metallic tastes. It's going to go to your muscles in here, so it has some efferent somatic, speech and swallowing. Now, it also is going to be watching the carotid sinus, but it has these big long axons down here going to your stomach, to your kidneys, to your liver, to your heart, and to your lungs. It's going to monitor organ volume and blood pressure. So that is afferent visceral, blood gas levels, blood pressure, volume of abdominal organs. It also has efferent autonomic. It controls all these organs. It's the main nerve that goes down from your brain and controls everything in your thoracic and abdominal cavities. So if you have a test in physiology and it's what nerve controls something in the thoracic cavity or in the abdominal cavity, it's probably the vagus. So we get to check all the boxes: swallowing and gagging, and speech, taste in the pharynx, control of the heart and stomach and all the internal organs, and blood pressure, organ volume. So, very good velvet. To touch and feel very good velvet. And last one's going to be hair. Hair. So remember on the first slide I said the olfactory nerves really attract, the optic nerves attract, but it would mess up the numbering? Well, this also, if you get rid of it, messes up the numbering. But it really doesn't belong. So the accessory nerve, most of it, from here down, is the spinal accessory nerve. and it comes off of the spinal cord on the lateral aspect of it. We're going to learn most spinal nerves come off the anterior. Only this little branch actually comes off the brainstem. And it goes up, and if you actually look at this picture, that one little branch that comes off is going to hook up with the vagus. So all of this right here is coming off the lateral spine. It is going to go into the brain and then back out the jugular foramen. And it goes to your posterior neck muscles, the efferent head muscles, neck, and shoulder for movement. So it's a very weird nerve. 95% of it comes off of the spinal cord laterally, not anterior like those anterior roots right there. And the fibers that do come off actually hook up with the vagus. So accessory is somatic motor only. So olfactory, optic, oculomotor, trochlear, trigeminal, abducens, faciens, vestibulocochlear, glossopharyngeal, vagus, accessory. And our last one will be hypoglossal. So the hypoglossal nerve is more anterior than the other nerves. And it's going to exit through the hypoglossal canal. And it's going to swing back around. And remember, glosso is mouth, glossary. Hypo is below. So it's going to go to your tongue muscles so you can move food around, and for speech, it helps you swallow. And the test for this nerve is you actually have the person stick your tongue out. So the hypoglossal nerve is somatic motor only. So on the online activities for this, I'm going to ask you what the nerves do and which ones are only somatic sense. It would be olfactory and optic and vestibulocochlear. Or only motor. Well, we have oculomotor, trochlear, abducens, that one's mixed, accessory, and hypoglossal. Or which ones are mixed? That would be vagus, glossopharyngeal, facial, and trigeminal. And that should not be a cross right there. I do not know where that came from. So here is our summary, a little bit more pretty. So facial, taste, somatic motor, visceral motor, vestibular cochlear, hearing only, glossopharyngeal. Taste has some visceral motor, salivation, visceral sensory. You have blood pressure. You have somatic motor, and you have visceral motor, which is salivation. Vagus does everything also. Taste controls most internal organs, gagging and swallowing, and this one's the controlling everything. This is sense. And then these two, just neck muscles and swallowing. So, which muscle does not deal with movement of the eye? So all of these deal with the eye. Abducens abducts. Oculomotor has motor in it, so that must be movement. It is constriction of the pupil and most of the muscles of rolling your eye. Trochlear goes to the superior rectus. So it's 2. The optic nerve is sense only. Which nerve does not have a motor component? The vagus and glossopharyngeal do everything. The facial, salivation, and muscles in the face, so no. So it has to be olfactory, which is sense only. Which nerve goes to the thoracic and abdominal cavities? No, face. That's below the... So which one of these? It's vagus.